Uh, my, Good morning, students. My name is Neha Parihar. I'm an assistant professor in Chandigarh University in the Department of Medical Lab Technology. So today's our topic is engraftment of transplanted hematopoietic stem cells. In your previous sessions, in your previous lectures, you already know about what is the hematopoietic stem cells, what are the different types of hematopoietic stem cells, uh, how we are going for the hematopoietic differentiation. So after that, the new topic is that engraftment of transplanted hematopoietic stem cells. How we are going for the first, in this session, we will know about the how we are going for the hematopoietic stem cell transplantation, what are the different types of transplant, what is the procedure, and then we will go for the engraftment, some of the factors which are going to influence the engraftment, what is the clinical significance of the engraftment of transplanted hematopoietic stem cells, what its clinical significance, and later on we will discuss the complications. So now we start the lecture. Hematopoietic stem
1 second, ma'am.
cells.
Sorry, ma'am. Ma'am, do you want to share your PPT, ma'am? Actually, we can see this flyer.
Okay, I'll
1
share the
second.
PPT.
Yes, ma'am. Please share the
But
PPT.
I'm not able to share the screen.
1 second, ma'am. Yes, now you can able to share, ma'am. I
Okay.
given the rights. Yes. Students, everyone turn on the cameras. Meanwhile, I will take one picture. Everyone turn on the camera, students. Yes. Okay. Thank you so much. Thank you so much, everyone. All right, ma'am. We can proceed, ma'am. Thank you so much.
Okay, sir. Thank you so much, sir.
Yes.
So, all of you aware what is hematopoietic stem cells? Hematopoietic stem cells are the multipotent self renewing or self able to progenite the, and it will give rise to new blood cells, and they are the cells which gives the which maintain the production and the proliferation of all the blood cells throughout our lives. Now, these hematopoietic stem cell, in this session, we are going to talk about the transplantation. So the first blood marrow transplantation was done by the Donald Thomas, and it was successfully done in 1956 within the two identical twins when they in the case of acute leukemia. Acute leukemia, you all aware, is the cancer of white blood cells. So, and the E. Donald Thomas also got the Nobel Prize for the same in 1990. Now, what is hematopoietic? What is the definition of this hematopoietic stem cell transfusion? All of you know the term transplantation and transfusion. Transplantation, in which we are going to induce or infuse hematopoietic stem cells from the donor to any recipient with the intention of repopulating or replacing the hematopoietic stem cells. It means when any person is having any disease or any condition in which their own blood cell lineage is proliferating in abnormally, like in case of leukemia. So at that time, we are going to transfuse them, or we're going to for the transplantation. So we want that transplantation to grow, repopulating in the system of that person. Now, what are the different indications why we are going for the hematopoietic stem cell transplantation? There are some conditions in which we are going for the transplantation, like in case of leukemia. In case of leukemia, it is a condition in which the white blood cells are proliferating abnormally. So in that condition, we are going for the blood hematopoietic stem cell transplantation. In case of lymphoma, it is a type of cancer which is associated with lymph. So in this, the cells are the abnormal cells are proliferating in the lymph nodes. And in case of aplastic anemia, in aplastic anemia, there is less number of there is in aplastic anemia, all the blood cells are growing less in number, so it is known as aplastic anemia. In these conditions, we are also go for hematopoietic stem cell transfusion. Severe aplastic anemia, in which our bone marrow are fail to produce the all blood cells, that is known as pancytopenia. In pancytopenia, all the blood type, all the blood cells like RBC, WBC, and platelets are grow less in number. So that condition, in that condition, we also introduced or infused the uh, hematopoietic stem cell from the donor to the recipient. In case of genetic disorders, also genetic disorders are those disorders in which there is some mutations in our genes. So, or in case of any wrong genes in our body, or we can say that abnormal wrong genes are present in our body. In that case, we also go for hematopoietic stem cell transfusion. Then autoimmune disorders. You all aware about what are autoimmune disorders. In that condition also, we are going for the hematopoietic stem cell transfusion. Then solid tumors. Solid tumors are the those types of tumors which are which is having the solid mass of the cells, cancerous cells which are growing in any part of your body. Solid tumors is just the mass, solid mass of tumors. Those are having cancerous cells. Okay. Now, hematopoietic stem cell transplantation. What is hematopoietic transplantation? This is also known as bone marrow transplantation. So when there is some changes in the techniques, when some advanced techniques in the introduced to the bone marrow transplantation, so at that time it is also known as hematopoietic stem cell transplantation. Earlier it is known as only the bone marrow transplantation. In hematopoietic stem cell transplantation, we are going to introduce or infuse donor stem cells into the recipient body with the intention of repopulating them, uh, or replacing the hematopoietic system in the recipient body. Now, CIBMTR, it is a uh, council of what we say that Center for Blood Marrow Transfusion and Research. It estimated that in per year, 65,000 transplants are introduced, are widely performed in worldwide. Okay. What are the different types of transplant? First is autologous. Autologous, in which we are going to receive our own stem cells. How we are going to receive our own stem cells? Uh, First, we are going for the chemotherapy or the radiations. Then those cells are going, those cancerous cells are going to suppress, and then the same cells are introduced in our body or in our hematopoietic stem cells. Allogenic bone marrow transfusion or transplant. In this, these are the transplant we are going to gain from the related donor or some unrelated donor. For that, we have to perform some compatibility testing. So on the basis of those testing, we are going to introduce or infuse the stem cells to the recipient. Synegenic, in synegenic, we are going to give the stem cells from the uh, what we call it triplet, or from the twin brother or sister. In case we are having twin brother or twin sisters, so at that time we are going for the syngenic, or we can go for the sibling and related donor, and that the stem cells we are going to take from the sibling in case as a donor. From unrelated donor, also we can take this stem cells from unrelated donor, we have to perform some compatibility testing. Now, from where we are going to take the stem cells? Of course, we are going to take them from bone marrow, peripheral blood, and umbilical cord blood. Uh, Okay, hematopoietic stem cell in the bone marrow. You all know bone marrow is where the stem cells are produced. So first we are going to extract the bone that's stem cells from the spongy tissues from the pelvic region or from the sternum region of the bones. Bone marrow, it is a rich reservoir of hematopoietic stem cells which is capable of generating all the blood cell types. First, we are going to give the general anesthesia or the regional anesthesia to the patient. And first, we are going for the to check whether the patient is allergic or not. And then we are going to prepare some PBF, and then we are going to check some how many numbers of blood cell count in the patient in the donors. Then we are going for the in this procedure we are having one needle. We are going to harvest the bone marrow. But first we are going to insert the needle to the bone, and then we are going to take the sample. Then peripheral blood. In the peripheral blood, it is recommended, highly recommended, because in this we are using the mobilization techniques. In mobilization technique, these techniques are going to enhance the peripheral blood circulation, by which it stimulates the granulocyte clone stimulating factors. And when it is reaches the bloodstream, uh, they are uh, they are going to give the adequate amount of stem cells to the patient. So this process is carried out by apheresis. Apheresis is a technique, or we can say that it is a machine which is used to separate the blood component. Also, after that, we can also take the sample stem cells from umbilical cord blood. Umbilical cord blood also contains the hematopoietic stem cells. So these stem cells we can collect from the umbilical cord, or we can also collect it from the placenta following childbirth. Now, cord blood is also rich in stem cells, but has a lower count of those cells compared to our bone marrow and peripheral blood. So in this umbilical cord blood, it is a non-invasive, because in this the donor has no risk to possess no risk to the donor, because it is obtained from the discarded umbilical cords after the birth. Now we are going for the what is the process of transplantation. First, we are going to check whether the person is allogenic donor or not. We are going to for the evaluation. Then we are going for the stem cell collection, then cryopreservation of stem cells, conditioning of patient, stem cell transfusion and recovery. That is engraftment. In this session, we are talking about the engraftment. Uh, but first we know about the transplantation. If we are not aware what is transplantation, how we are going to discuss about the engraftment. So wait. Sorry, am I audible?
Yes, ma'am. Audible, ma'am.
Okay.
Yes, ma'am.
Pardon. First we are going for the collection. Like, we have to collect the stem cells from the patient marrow,
Sorry,
or
ma'am.
by the
Ma'am, your PPT not visible, ma'am.
yes sir.
You have to share PPT.
Okay sir.
Yeah.
Okay sir. Mm. Now it is visible?
Yes, ma'am, visible. Yeah.
Okay. First, we are going for the collection of stem cells from the patient bone marrow or from peripheral blood. Then we are going for the processing of samples. Then we are going for the cryopreservation. Then the fourth one is uh, chemotherapy, then infusion. So we are going to discuss it in detail. This is the stem cells. In this picture, it shows that how the stem cells are removed from the donor body. This is the epiphysis machine in which the blood components are going to separate out. There are this one is the whole blood. How with the help of this machine, the blood components are separate out, and then this in this image, the now the patient received the stem cells received from the donor. This is the bone marrow transplantation. This image shows that this is the different images which shows the transplantation unit. These are the transplantation units. First, we know what are the different samples. Then we will discuss how we are going to process the samples. Now the cryopreservation. After collecting the samples, we are going for the cryopreservation. In case we have to preserve the samples, that donor sample for a longer time duration of time, then we are going to follow this process. In cryopreservation, we are going to collect the stem cells, and we are going to put those stem cells in liquid nitrogen until the actual time of transplantation arrives. Now transplantation cryopreservative which is used for the transplantation is dimethyl sulfoxide. Now dimethyl, why we use dimethyl sulfoxide? Because it is going to maintain the viability of the cells during the storage period, and the time we are going to give and the temperature we are going to maintain is -80 degree to -180 degrees Celsius. Transplant process. Now in process where how at the time of transplantation, what are the different conditions we have to maintain at the time of transplantation? At the time of chemotherapy, in this condition the actual time duration is 7 to 8 days. At that time the patient is kept in the isolated room with the HEPA filters. Why we use HEPA filters to that room? Because with the help of HEPA filters, because they have mesh protections, mesh filters. So with the help of these filters, even small dust particles, any pathogen is not able to invade that area, and the patient is safe from the foreign particles. At the time of chemotherapy, we are going to give the chemotherapy or radiation to those patients at the time of we are trying to eliminate the malignancy, or we are trying to suppress the immune response. If when we are going to give the patient new donors hematopoietic stem cells, they might going for the rejection of new stem cells. So at that time we are going to give some immunosuppressive therapies to the patient so that they are not going to reject the new stem cells. Bone marrow transplantation regimes vary from one patient to another and depend upon the type of cancer. Now it states that the bone marrow transplantation procedure is different from or the conditions which arises at the end are different from one patient to another. This is a hematopoietic stem cells infusion. Now after the transfusion, the engraftment is the procedure, or we can say that it is a recovery phase which occurs after the transplantation. First, the patient who have malignancy or who is suffered from any leukemia or any cancerous condition or any genetic disorder. First, he will go for the transplantation, hematopoietic stem cell transplantation. After that, the engraftment after the successful transplantation or transfusion of hematopoietic stem cells. uh, how we are going to know about the this is the process in which we are going to see the different phases of engraftment. What is the recovery phase? It is the recovery phase of the hematopoietic stem cell transfusion transplantation. Now, engraftment refers to the successful establishment and sustained growth of transplanted hematopoietic stem cell within the recipient bone marrow. Now, we can also say that it is when the infusion of donor hematopoietic stem cells in the recipient body, what are the different, how we are going to achieve that goal? Okay, so we are going to see that process in different categories. Like first, we are going for the primary engraftment and then the secondary engraftment. Now, there are some factors which are going to affect the uh, engraftment success. First, what will happen? First, we are going for the pre-transplant conditioning. Before hematopoietic stem cell transplantation, some of the patient or some of the often recipient undergo pre-transplant conditioning, which includes high dosage of chemotherapies or radiations. So, it serves the multiple purposes. Like in case of recipient body, exist the bone marrow cells and creating space for the donors hematopoietic stem cells in graft. Or we can give the immunosuppressive drug to the recipient to suppress their rejection of the donor cells. Or we can provide the infusion of donor hematopoietic stem cells, or we can provide the homing to bone marrow. In this homing to bone marrow, infused hematopoietic stem cells are collected from bone marrow and it gives to the blood stream. Now, some chemokines and adhesion molecules plays the crucial role in this migrations and helps the bone marrow to proliferate and produce the cell lineages. Now, factors affecting engraftment success. First is HLA matching. HLA matching is human leukocyte antigen. In HLA matching between donor and recipient is crucial. So, if HLA compatibility reduces, the chances of graft versus host disease increases and it enhances the engraftment. Then second one is condition regimen. In conditioning regimen, the intensity of pre-transfusion transplant conditioning where the recipient immune system and bone marrow have the high intensity may increase engraftment success but also carries high risk. Now, graft versus host disease. These are the graft versus host disease are mainly occur after or within the 100 days of the engraftment. Okay, but in case of graft versus host disease, it is mainly the skin diseases. So, if we are going to proliferating measures to prevent the GVHT, so we have to give the immunosuppressive drugs to the at the time of engraftment. Clinical significance of engraftment. The first is prevention of graft rejection. At the time of graft rejection, at first is prevention of graft rejection, prevention of graft failure, correlation with transplant outcomes, or relapse or survival. In prevention of graft rejection, the hematopoietic stem cells are uh, wherein the recipient immune system recognizes the donor cells as a foreign particles, and they are going to generate the immune response against the recipient body. So to prevent the graft rejection, we are going to give the immunosuppressive drugs, and to reduce the and to provide the proper HLA matching at the time of at the time of transplantation, and which is going to mitigate the risk of graft and immune response against them. Now the second one is prevention of graft failure. In graft failure, uh, engraftment failure occurs when transplanted and occur when transplanted hematopoietic stem cell fail to establish hematopoiesis in the recipient. It is going to lead the cytopenia and clinical distortion. In cytopenia, it means the lower production of RBCs, WBCs, and platelet. These are the factors which are going to contribute inadequate stem cell dose, poor stem cell viability, or graft versus host disease. These are the conditions we have to prevent at the prevention. We have to look for the graft failure. Now, for the early detection of graft failure, we have to go for the timely intervention and the timely alternative for the treatment modalities. And last one is the correlation with transplant outcome. In engraftment serves as a critical milestone in hematopoietic stem cell transplantation. So when we are going for the improved disease control, this is going for to reduce the risk of relapse and enhances the chances of survival of the patient with hematological malignancy. So for this correlation, we have to maintain the engraftment, and we have to improve the disease control. We have to go for the regular treatment and regular intervention or timely intervention for the uh, engraftment, after the engraftment. Now, complications of what are the different complications we can see in the after the engraftment. Graft versus host disease. Graft versus host disease, either it is acute disease, or it is chronic. In acute graft versus host disease, it occurs within the first 200 days and is characterized by the activation of donor T cells against the recipient tissue, which it also leads to the inflammation and tissue damage in various organs, such as in the skin, in the liver, and also in the GIT tract. The second one is the graft failure. Earlier, we also discussed about the graft failure. So, in the graft failure, it occurs when transplanted hematopoietic stem cells fail to establish the sustained hematopoiesis in the recipient, leading to persistent cytopenias and clinical distortions. Like when our transplanted hematopoietic stem cells are sustained in the hematopoiesis at the time of at that time, the our bone marrow is not able to produce, or it is unable to produce the higher amount of, or the normal range of cell, that is cytopenias. Like all the blood type cells are lower in numbers, so that indicates graft failure. There are different types of graft failures, like for the host factors, like chemotherapy, at the time of chemotherapy, or via immune mediated rejections. So these are the factors which leads to the graft failure.
Sorry,
Other
1 second, students. The time is up, and please join back to this lecture. Okay, only for 5 to 10 minutes. Then the class will be finished. Please join back because it is almost time left. Okay.
Okay.
Only 5 more
Okay.
minutes. Please join back. I'm ending the session and we'll join back again because time.
Okay. Okay. Infections. If infections